Hi, everyone. I'm Dr. Sainagori. I'm back here with Femhealth, and today we are talking to Dr. Kim Thornton. She is an REI specialist with RMA of New York, and today we're going to be talking about miscarriage. So as you know, 1 in 4 do experience a miscarriage, and many people have questions surrounding what to do after the miscarriage in terms of how to get pregnant, when will they ovulate again. So I just want to start by asking you, what is the recommendation for becoming sexually active again after a miscarriage?
So after a miscarriage, a couple should refrain from intercourse for 1 to 2 weeks after tissue has passed. And that is mostly due to concerns about an increased risk of infection from the cervix having dilated as the pregnancy passed. But after that, it is safe to resume intercourse.
And what about if someone has had to undergo a D&C to remove more tissue?
Typically, we usually say wait 2 weeks after any sort of D&C surgical procedure before resuming intercourse or before putting anything in the vagina, such as like a tampon. It is always best after a miscarriage to be using pads.
And so typically, because of the timing of when miscarriages usually happen, what happens in terms of ovulation? When can a woman expect to be ovulating again, and how can she monitor that?
So it can take some time. It can take up to 2 to 3 months before a woman's menstrual cycle will resume to her regular natural cycle, or before ovulation may resume. It's really dependent on how far along in the miscarriage somebody was. So a very, very early loss, something like a biochemical pregnancy, somebody may just ovulate again within a couple weeks later, while a loss that was, maybe further along, 10, 11 weeks, is more likely to take those couple of months before ovulation resumes. I would say on average for most first trimester miscarriages, it can take 4 to 6 weeks before the HCG or pregnancy hormone level is even out of the blood system.
And is it safe then to try to get pregnant again, like once ovulation starts, or should you wait even longer?
Yes, it is safe. So many patients always think that there's a waiting period where it's not safe if they get pregnant too quickly, and all the evidence and data does not support that. There is no evidence that supports that a patient needs to wait to try to get pregnant again once ovulation resumes. Once you're out of that 1 to 2 week time frame, depending on what your doctor advises, you're okay to start trying again.
And what about if the loss is a little bit later, as you mentioned? Is that the same recommendation? Once you start ovulating, it's essentially safe to be pregnant?
Yep, it's safe. And we know that, I think in the old days, we used to think, oh, maybe we needed to wait this X amount of months. And we realized people were just waiting. And the longer we wait, the older we get, it's harder to get pregnant. And so there's really no need for a delay in conception.
Yeah, that is really a big concern for a lot of people these days. A lot of women are getting pregnant. That is really a concern for a lot of women these days. They're getting pregnant later in life, and timing is so important. Thank you, Dr. Kim, so much for being here. Really appreciate all your wisdom and words of advice on this very difficult topic that a lot of people unfortunately have to go through. And we really appreciate you enlightening us.